Hi everyone. I hope everyone is well. Welcome back with another video as proposed on the Friday. So this is the details version of that the same and the one of the new course is came as we have discussed. So let's start. How we can amplify social impact unleashing the potential of quantitative analysis and GIS. So as we have discussed on the Friday, so one of the course has came from Ajim Premji University for the cohort of 2024 specifically on quantitative analysis and GIS. So let's start how this will be a ladder for a public health professional to increase their career. So the very first details that regarding the course, so this will be starting from the January 24th of year 2024. The basic fundamental it has been divided into two parts. The first will came for the quantitative techniques, and the second will come that the same that key in the connection of quantitative analysis, how we will be going to utilize GIS tool to visualize and especially relate tool in the national and subnational data. We will discuss later on with the more details with the cohort of some of the example. I will share the personal example. So the first thing is that ki course detail we have discussed, and now the thing is ki the duration it will be for the 3 month of the duration. So it will start from the 8th January onwards, and it will end on the 6th of the April. The venue will be Ajim Premji University, and the very important thing is that ki application deadline is September 30th. So if anyone is looking, so we have to do on the rigorous basis that we have to fill this form. I will share the more details in this description box. Do check and the link will be also over there. You can go through that. Regarding the course schedule, and this will be the first on campus. That the first part will be the on campus. That will be from January 8 to January 19, and after that it will be come for the online board. And the course faculty will be the likewise key course faculty is four, and majorly they are having a lot of experience and skilled in this parts. So let's start from Divya Sharma. So she is experienced in social networking analysis and also likewise agent-based modeling. So that will give a major impact on the first part of the quantitative as well as the GIS as well. Neeraj sir has did MA and PhD in economics from University of Mumbai, and he was also before Ajim Premji University he was working with government of Maharashtra. And the third comes to the Niti, and Niti was a scientist, and she's coming from like she's having 20 year of experience, and in the data analysis. And previous to it, she has worked with Clark University, Boston University as well, Terry School of Advanced Sciences as well. Now she is with one of the course faculty in this. And the last one is that ki Joseph Martin. He was working with the last he was working with the WHO in the humanitarian support in the project of WHO, and also he was based as a research position in the Christian Medical College. Now the course overview that ki like as coming from the fresher part of the Master of Public Health, so we are not aware about that ki what is qualitative analysis and what is quantitative in deep. We are not knowing about that, and also we will not be knowing about the likewise we are knowing about that ki what is GIS, but as in the deeper content we will be not knowing in this how this is connected. So when I have started my career, so I was not aware about that GIS. So I was starting working with Netherlands leprosy relief. So I met one of the guy over there. He is directly responsible for the GIS only. So we will discuss that key how the GIS is important in this public health domain, who is working at the ground root level and how is impacting on the data and as well as the data collection as well. So the both combination of the both skill will be a valuable asset for the professional as well as organization at the various level. So this will create a lot of impact. And likewise, if we can go some of the details version in this, mm, likewise, the two part in the course where with the first is we are going with quantitative. analysis. So while coming from the field, so we are likewise we are having a theoretical parts majorly. So over here it will give a great impact on that understanding the data. So likewise let us suppose take one of the example of maternal health in Uttar Pradesh or maternal health in India. So that is an open data source available in the HMIS portal. But the thing is ki who is able to understand the data and who is able to do that analysis on that data and who is able to do that research paper after understanding and analyzing that data set specifically. So this all this content will come from here. Apart from this key, how to clean the data and how to prepare the data set on the national and sub-national level. Likewise, if it is district-based data, so that was a short cohort. So that is able to we will able to analysis. So there is some of the technique when a larger data is coming. Likewise, at the NHSRC end or the Ministry of the Health and Family Welfare, a bigger data set on the national base is coming. So we have to analyze on that. That will come under this course. How we can understand that. Exploring the data analysis will also come in the part of quantitative analysis. So how we have to do this, the data analysis in which set we have to move on. So greater impact will be over here. And conceptualization of the data will come under this. We will be learning in this course in the part of quantitative analysis. Apart from this, after doing all these four part, meaningful and concrete outcome of data we have to drive on. And apart from this, we will learn about data visualization as well in the quantitative part and trend analysis, and the end that it will also come after doing this all the parts. And that will we can connect with that one of our the paper that peer review. So what has been trained has been shown in the previous review research papers and what is coming, so we can correlate over there. On the other hand, the second part for the geographical information system for social impact. So, likewise, this is also related to the quantitative part, but the major part which is difference is coming likewise geographical information system and data taking. Likewise, if we are taking the data of Uttar Pradesh and Delhi, so we have to take a concrete boundaries of Noida and Delhi, which is coming. That boundary we have to define. Apart from this, we are taking that coordinate as well, longitude and latitude, and based on that layer, that will divide that parts. So apart from this, geocode is also over there. We will learn about this geocode in the geographical information system, and a lot of software is over there. And as I know that our the QGIS and ArcGIS that will also come in this, and how to join a spatial and not a spatial data set will also cover in this GIS part. So this is the overview, and I would like to share one of my experience where it has been directly connected with the quantitative data and GIS. So when I have started my career phase in 2017, November 2017, with Netherlands leprosy relief. So we were working on that key. Post-exposure prophylaxis for of the leprosy. So that was the research, but clinical trial and research part it's still ongoing in the three of the countries. In India, it's ongoing at Fatehpur of Uttar Pradesh and Chandoli. So we have to likewise I was working as a RA, and a lot of people is work was in that our team. So all the RAs has to do that key. You have to visit that specific patient house, and you have to mark that in our software is provided. So that is directly taking coordinates, and the coordinates like was longitude and latitude, and that will create a layer and sub layer. So that was a part of directly coming under the GIS part. And another thing is that key when we are going for this quantitative data based on the questionnaire, and that and after that the clubbing that these both part will be a very likewise a data driven mode will coming after this. So this was a very important role, and likewise I think that's okay. We should know about that either from this course or we can learn self as well. Apart from this, In 2021, I was working with, I have been selected for Bernard Van Leer Foundation. So that was also a part of GIS mapping. So which was gone on a lot of countries, like was over here, Netherlands, Belgium, India, Malaysia, Indonesia. A lot of, I think that's okay, 24 or 34 countries, 24, I think that's all. So that countries is over there. So from the India chapter, I was also over there. So what we have to do, we have to work on this key coordinates we will be providing. So that one of the instrument is over there that is directly taking longitude and latitude from that, and that is also tracking that air quality also over there. So that is after this that the project is started in the Maharashtra Urban 95. So I think that's okay. The both part is very important as a public health professionals. Like basically, we have discussed already part of quantitative and GIS. So this program objective is specifically which is expected to run from Ajim Premji University. So this certificate program is important to social sector organization, quantitative analysis GIS, a skill for social action, like basically based on organization and impact that several ministries is working on this, so that will create a great role and great learning, and after learning we can implement as well. And likewise, also I have said that in the GIS we will be working on the spatial and non-spatial data set, that how we are going to club that boundaries. As I have given the example of Delhi and Uttar Pradesh, so that is software based, likewise QGIS and RGIS is over there. So, analyzing, interpreting, and visualization of data. After going through this course, we will be able to do this all effectively. The importance of quantitative analysis and GIS, likewise, key urban planning and development. So, one of the project is Urban 95 is ongoing in the Maharashtra from Bernard Valley Foundation funding. So, that will a greater opportunity in these areas. We can also grow through that. And likewise, we are also knowing about that a lot of issues in urban transport in the Bangalore. We are coming to know about that. So, this is also creating an impact, and this is also creating a job areas in transportation and infrastructure planning. So, healthcare management, likewise, improving healthcare services, likewise, utilization impacts and resources allocation based on based on this key prevalence of a specific disease. So, this is also one of the major part where we can work. And likewise, disaster management is also one of the part, but specifically are related to our course, specifically the public health. So it's coming the point number two, healthcare management. Apart from this, demographic analysis also undercoming, and we can think about this, and we should learn about this, and we have to create ourselves empowered with the skill sets and data interpretation and that all. So, a career opportunity, likewise, in Indian context, this is not a major part is coming of the career opportunity, but we can think about that key healthcare analyst, market research analyst is also a booming part. And after getting these skills of quantitative as well as GIS, so research-based organizations over there was directly working on this research papers and data collection, data tools creation, and academia is also over there. And last the not least, that key a last opportunity will be of the freelance consultant we can provide. So that's it from my side, as per the last video which we have proposed. So the next video will be coming on some of the grant is over there, and research position opening is over there. So till time, take care and bye. So we will be back in the main duration with some of the new recordings as well as with the new data set. Also, I can say that six new courses has came out, I came to know about this by this Saturday only. So that is from PHFI and IIPH1 Delhi, Delhi chapters. So we'll create that part as well by this week. Till time, thank you. Bye.